At a new report from the Safeguarding Health in Conflict Coalition, it says attacks on healthcare workers in conflict zones have risen marginally. According to the latest figures, in the year 2018 saw 973 attacks on healthcare providers, in which 167 workers were killed in 23 countries. And as Laura Walubengo reports, the biggest scare lies in the Democratic Republic of Congo, where the fight against the spread of Ebola has been scaled down due to insecurity.
In January 2018, a suicide bomber drove an ambulance loaded with explosives through a checkpoint in Afghanistan. The explosion that followed killed 95 bystanders. In February, 13 hospitals supported by Médecins Sans Frontières were bombed in Syria's East Ghouta. In Nigeria's Borno state, Boko Haram militants attacked a camp for internally displaced persons and killed 3 aid workers, one of whom was a doctor working for UNICEF. These are some of the attacks targeting health workers that the Safeguarding Health in Conflict Coalition says is part of acts of impunity that are being perpetuated by armed combatants in conflict zones. According to the report, 973 attacks left 167 medical practitioners in conflict zones dead. 710 others were injured. This number contrasts marginally with 2017, in which 701 attacks were recorded. Countries that lead in violence targeting healthcare providers in conflict zones include the occupied Palestinian territories with 308 cases and Syria, which recorded 257. These two are followed by Afghanistan, Yemen, Libya, Central African Republic, Pakistan, Somalia, Cameroon and Sudan. In these nations, administering of polio vaccines has been hampered by the threats on healthcare workers. Perhaps the most chilling of this reality is the Democratic Republic of Congo. Violence targeting health workers by armed militias has seen many organizations scale down intervention against the spread of Ebola. A disease has so far killed over 1,000 people, and the number could rise. With Ebola spreading unabated, the Safeguarding Health in Conflict Coalition is fearing that the disease might spread even to neighboring countries, just like the violence that is rampant in the affected North Kivu province. Laura Walubengo, CGTN.
Well, let's take a closer look at this issue. Now joined